Welcome to today's webinar. We're delighted that you could join us. We have a few helpful tips to help you enjoy the webinar and make it easy for you to have access to the information. Check the chat area to download handouts, both the slides as a PDF and a number of wonderfully useful handouts from the field. We have muted all participants today so that we can manage this large group of friends and colleagues on the webinar. Um, if you have questions related to content, please use Q&A today. So any content questions, use the Q&A at the bottom of your screen. For technical questions, use the chat box. Natasha is ready and able to help you if you're having any technical difficulties today. And we want to acknowledge that there is such a high volume use of Zoom in these days with the pandemic that we may have some technical difficulties. And if so, please be patient about that, and we will make this recording both for the webinar we present today, and there is already a recording posted on our website for the webinar we did on Tuesday. We hope that the Institute for Patient and Family-Centered Care will be a resource to you. We have a number of resources that are on the website now, and we will be posting more by the end of the weekend and next week and continuing. So we hope that this will be an ongoing resource for you in helping to apply patient and family-centered care to the work that you're doing at this time of crisis. I'm Bev Johnson. I'm the president and CEO of IPFCC, and I'm joined today by my wonderful colleague, Mary Minetti, who is a senior policy and program specialist. And we're basically going to be having a conversation with you about patient and family-centered strategies in the time of COVID-19. In preparing for this webinar today, we received over 100 questions from all of you that have registered for these webinars. And we obviously can't deal with all of them in this hour that we have with you, but we will be answering these questions through posting of FAQs on the website. So please stay tuned for that, and please keep sending the questions and the examples of emerging best practice as we all work together. We've chosen today to focus on two objectives that were foundational to many of your questions. How patient and family-centered care, those core concepts and the related partnerships with patients and families and residents in long-term care communities can be a resource for healthcare organizations and communities dealing with the epidemic. We have a key resource in those partners, and we want to be able to help show you how you can work together. In addition, we will be talking about various approaches to maintaining family connections to support patient safety and healing and to prevent the spread of infection. What we share today is really what we know today. Everything is changing so rapidly, really by the hour, by the day, as many of you know, that we know that our recommendations and the situation may need to change in the coming days. But we hope that it will be useful what you learn from us today. We also want you to know that we're not offering clinical information. We urge you to listen to and respect public health, infectious disease, and other clinical experts. But we are asking you to draw on your knowledge and experience with patient and family-centered care and those essential partnerships with patients, residents in long-term care communities, and families, and apply that expertise and understanding to shape policy, the way we word policies, and the recommendations to promote safety for all. I think most of you on the call today know these core concepts. They're deep in your hearts and in your minds. But just as a reminder, we define patient and family-centered care as an approach to the planning, implementation, and evaluation of healthcare grounded in mutually beneficial partnerships. And those core concepts of respect and dignity, information sharing, sharing of complete, accurate, unbiased information are key core concepts. In addition, encouraging and supporting patients and families to participate in care and decision-making, and central and always at the heart of this practice is collaboration with patients, families, residents in long-term communities, and all of healthcare professionals. As we create policies, we disseminate information about policies, that we how we educate and orient staff for this new reality right now. And in the future, we will be doing research together on how to even do this better and be better prepared for pandemics. True North is your orienting point. Just as a compass needle points toward a magnetic pole, your True North pulls you toward the purpose of your leadership. And in times like these, the core concepts of patient and family-centered care can serve as a North Star to help inform decision-making, practices, and public health strategies. Let me repeat one more time. The core concepts of patient and family-centered care can serve as the North Star to help inform decision-making, practices, and public health strategies. We have been inspired by Rachel Raymond, a wonderful healing physician, by so many of her wise words over decades. And I think today she has further wisdom to share with us. We usually look outside ourselves for heroes. It has not occurred to most people that they maybe already be the role model they seek. And I see each of you on the call today as role models as we go forward to address the issues of COVID-19. Essential partners for safety. That's what patient and family advisors in hospitals and clinics and resident volunteers in continuing care retirement communities are. We need them today still as essential partners for safety. And there's so many ways that they can be involved. And you will learn more about what we've gathered thus far about their partnerships. We learned a lot about how to deal with a worldwide epidemic in 2003. The SARS experience, particularly the SARS experience in Toronto, provides lessons that we can learn today. We learned from that experience. IPFCC was about to have an international seminar in Toronto in the midst of the SARS epidemic. And we had to change our plans and postpone our plans. But we also learned about what was happening to patients and families and staff and clinicians when people restricted so extremely family presence and other visiting restrictions, and they didn't provide adequate emotional and psychosocial support for patients, families, and healthcare workers. And we have shared some of those observations and recommendations from a chapter that we wrote in Privileged Presence. It was As Hard as It Gets, the Impact of a Global Crisis on Family-Centered Care. And earlier today, I received 2 articles that I may be able to share with you later about from um, ethicists who are working, who, who shared similar advice about how we protect safety, we honor population health and public health recommendations, but at the same time, remember the importance of family presence, patient and family-centered care, and support, psychosocial support. I know many of you on the call today are patient and family-centered coordinators and staff liaisons, and you have a critical role. We've purposely reached out to you all, not to reach out as we often do to as well to CEOs and chief medical officers and chief nursing officers and other clinicians. But we think that those of you who are working directly with patient and family advisors and councils and committees have a very important role right now. You can help address the feeling that some PFACs and some patient and family advisors and resident volunteers are feeling that they're no longer needed, that they are experiencing the social isolation without that connectedness to you. So you can reassure them that they are important and valued, and that to be patient while we put a variety of virtual processes in place to continue the work together. I think you can help your organizations with the messaging, the communications, the dissemination of messages to ensure the tone and wording is right. You can also post on your websites practical adaptations that patients and families are making to be safe and to follow new restrictions. This would be encouraging to your constituencies that where your website is still a resource of information. I would also collaborate with patient and family advisors and resident volunteers. You're the key connection to broader communities. And so you can be invaluable in disseminating information about policy changes and accurate public health recommendations on how to stay safe. So tap into their resource. Also, I would all of you should be thinking about how you can use technology and telehealth to communicate with your PFAs and resident volunteers to minimize the impact of social isolation and to contribute to safety, health, and well-being. I think also as staff their roles are shifting. Some of them are stationed at your entrances to be screening people and enforcing restrictions. How you can train staff and be efficient, time efficient with it, on how to implement those in a respectful, patient, and family-centered way. Again, the use of language appropriately and tone. And then I would urge you, if you were working with advisors, to help them share their appreciation with staff. We really need to help staff know that they are putting their lives on the line and are at risk for their own families, and that we really appreciate what they are doing. So you can help send that message along through your website or many other ways. And for patient and family advisors and resident volunteers, there's so many ways that you can be helpful. I'm sure you heard some of that when I was talking about the facilitator that you work with. But I think your voices and your perceptions about the language used can be extremely useful in developing messages and disseminating it broadly to the community. You can also use technology and telehealth to stay connected with each other and the broader community and your healthcare organization. And again, sending positive appreciation of what staff is doing. I just received from Nova Scotia a few minutes ago an inspiring letter from the chair of a patient advisory council, a patient partnership council, family. I think they call it a family leadership council. And it was published with the hospital update, daily update, to convey to all staff and clinicians how much they were appreciated. I've talked a lot already about that words matter. So in reviewing your policies, messaging, web posts, signs, any communication, it's so important that we think about the tone and the use of respectful, collaborative, kind language. Another way of saying that is the language of partnership, the language, patient and family-centered language. You may not like the policy itself, but if we can express it in a positive way and remember the importance of families as we write it, we may be able to come through this difficult time in a better position. Always in these messages, over and over again, try to convey the respect for the role of families as care partners and their importance to patients in hospitals and clinics and residents in continuing care, retirement communities, and skilled nursing, and assisted living. We want to underscore that because there may be ways that we can connect with them through technology and other ways if we can't be physically present. And always in all the messaging, look for clarity of the message if you're an advisor about writing on it, but always include the why. Safety for all. That's what's guiding these changes in policies. And then you can also bring, is the written message, are the words understandable for the target audiences? So it's important to reach out to your diverse advisors and ensure that they are part of this process as well. And an area that's changing so rapidly in healthcare today is primary care. We're reducing the number of well visits, the care that's actually provided there. They're moving to telehealth and care by telephone. And they're limiting the number of people because the rooms are so small in primary care. You can't get the social physical distancing in an exam room. So it's important there, particularly in primary care, to develop clear, respectful, understandable messages in the appropriate languages for the target audiences. And think about all these different ways, answering machine messages, messages that are pushed out to patients and families, scripting for receptionists and individuals answering the phone, written messages that can be handed out to reinforce the verbal messages, and then your signage, both in your facility and outside, and with other trusted partners. And now I'm thrilled to be able to turn this over to Mary, and she will lead you through the next set of slides.
Great. Thank you so much, Bev. I want to talk a little bit more about words that matter and then move on to other important information. And I want to talk about the feelings of words and how we communicate feelings and caring through the words that we use. So empathy is going to be, and compassion are going to be so important during this time. And these words are examples for patients and families, but we also need to be aware, if we're patient and family advisors or others interacting with healthcare professionals, that the way we treat our healthcare professionals with empathy is important as well. So it's important to acknowledge the feelings, and one way is to acknowledge that this is a scary and confusing time for many people, and that those feelings are really normal, that this doesn't mean that there's something wrong with them. It's important that we use our words to open the door and offer assistance, to find out what questions people have, offer how can we help, and begin those kinds of dialogues. And even during this time, as we think about public health needs and things. We need to build on the strengths of all individuals and their families and communicate that we have confidence in them. We have confidence in them to be partners in helping maintain social distances, to follow requirements as changes are made as we learn more about this virus, and to help them reflect back on, in the past, what has worked for them in times of stress, and help them remember those times and then begin to help them think about what might seem like a good first step. One of the things that I saw today that really caught me and really applies to this particular thing is a quote by Nathan Gray, who's a doctor, and he says, as we take stock of masks, gloves, and ventilators, we must also be ready to dig deep into our reserves of patience, communication, and compassion. And I was thinking of what a great reminder that is, that it's a both and kind of world. And we recently on PFCC Connect had a comment from Terry Griffin, who is a nurse practitioner in the Chicago area and works in NICU. And she was distressed by some of the words that she was seeing as people were communicating what the new policies are. In fact, she said, it breaks my heart to read words used to convey necessary information to patients and families. And even though these are desperate times and we need to take desperate measures, we need to not use the word non-essential when we talk about loved ones and their role with their family. We may need to limit access to hospitals and patients, but we need to minimize the power language that says we're in charge and you're not important, but we need to include the language of partnership and really remind everyone of the value of family. So as you think about the messages and the words that you're using, always try to lead with caring statements, like we really care about you and your family. And then in the middle is the factual statement. Our temporary restrictions, because hopefully these are temporary, we're gonna fight this virus, we're gonna win. They're necessary for you and the community and the healthcare providers for everyone's safety. But we're grateful for the role that you're playing in this. So end with a caring statement, really important stuff. So we all have what it takes to make this work. We have what it takes because for those of you that are healthcare workers, you went into the healthcare field because you care about people, because you want to be helpers, because you want to make a positive difference. If you're a community member joining this call and you have volunteered with your hospitals and your other healthcare organizations to be patient and family advisors or volunteers in the healthcare system, you have done that because you want to make a positive difference and because your heart is in it, that you care. So whether we're talking to patients or caregivers, let's use what we have already: an open ear, an open heart. Listen deeply and share your feelings, connect with others, and remember the importance of our shared humanity. I want to take a moment to talk about how important we need to be thinking about strategies for supporting healthcare workers. It is a difficult time. They're in a current environment where they're vulnerable and are experiencing lots of stress as they balance work and family demands. They want to take care of patients, but they also want to keep their families safe. Sometimes what that means is we need to build some flexibility into schedules and assignments because many states have their schools closed. And so not only are we working out in the hospital or the community primary care settings, but we also are having to balance and juggle our childcare needs. So if we can build flexibility, that's important. Think about creating ways to communicate and have available messages of hope in staff rooms. So you can use a whiteboard or set up a flip chart so that as people are coming and going, because we aren't all getting together with the demands on our time, and put some sentences up there that can get people thinking about what keeps them hopeful, what fills them with gratitude, and what we want our coworkers to know. It's really important to be checking in with each other, and we have to think about different ways to do that. Leaders can conduct rounding to check in with staff find out how it's going, hear what their needs and concerns and issues are. And then PFAs, you can begin to write notes of encouragement and appreciation to staff and clinicians that you've worked with in the past, or to the frontline folks that you've worked with, even receptionists or administrative assistants that have assisted you in your work as a PFA. Because the important thing is we need to maintain the connection. And oh, are we so lucky now that we have access to technology that wasn't there 10 years ago, that wasn't for many even there 5 years ago. Video conferencing, FaceTime on our phones, being able to use that technology and leverage that to maintain the social connection is so important. And I put this picture of the old time pen up because sometimes for certain populations, we want to also reach out with notes and with paper. So for instance, in an assisted living place, it may be great if your children who are staying at home can write notes or draw pictures of things that they're doing and drop it off to those kinds of healthcare organizations that they can share with residents. That maintaining the connection is so, so very important. So now we're going to do what you said you were most interested in doing, and that is we're very quickly going to move through a number of real life examples of things that organizations are doing to maintain the connection, to honor the core values of patient and family-centered care, and yet respond to the epidemic, to respond in ways that keep the community safe. So it does seem like everything is changing minute to minute. It's almost a blur. So it's normal to be anxious and unsettled, but if we can continue to be open to partnership and remember that we're all in this together, this is going to be a good thing. So we reached out to a number of people, and not everybody that we could possibly reach out to because of the time frame, but we want to share what we heard and learned about things that are happening out in the community, because that's really important. So Beaumont, oh, and I want to just also bring to your attention that there are handouts and examples of things that are actually happening in healthcare organizations. Beaumont has some handouts, Children's Mercy, and so please do download those because you're going to see the principles in action. So Beaumont really emphasized communication, and what they did is they leveraged their patient and family advisors and leaders who are staff in paid leadership positions for their patient and family experience office. And they did a number of things, those staff members. They helped develop guidelines and communication about how family presence and visitation policies were changing in response to COVID-19. They were sensitive to those language issues. They worked on compassionate communication education to support frontline staff, and they convened their patient and family service staff. Those are the individuals who often are the ones who are getting complaints and grievances related to COVID-19. And they're really taking a systematic approach to categorizing complaints and identifying both, as a group, identifying both person and system solutions to common complaints, and then create education and workflows to address those issues. Because we're in uncharted territory, and we need to be aware of what the patient and family voice is telling us and be able to respond to it. So one of the handouts that you have is the communication document. It's called Communicating and Connecting During a Crisis. And what I love about this document, and you're going to be able to download it and read the detail of it, but let me just tell you some things that were really great about it. They thought of this document not only as support for staff about what they needed to do in interaction with patients and families and how they can communicate with them, but there was also important practical suggestions for them about how they can take care of themselves. They provided words and scripts as examples, and they also acknowledged the feelings and appreciated the sacrifice and the commitment that the frontline workers were making. And the ability to combine both of those things was very powerful in that particular communication tool. The other thing that we wanted to talk with you about is some of the ways that individuals were being keeping up the social connection. And this is a great way that they did it. Henry Ford Health System. Many of you in hospitals have kind of in-house educational systems that are on your TVs so that patients and families can see them in normal times. And what they did is they reached out and they repurposed some of that work, and that was so important, and created the opportunity for people to make well wishes to individuals from the community to patients. The goal was to enlist the community to keep spirits up and to spread kindness to those that were hospitalized. And I think this is just a wonderful idea. I think that some hospitals also have cheer cards that can be sent. So there are a number of ways. So think about those systems that you already have in place that can be utilized for this. I'm shifting now to a children's hospital, Children's Mercy, that's doing a number of really exciting things. But I want to bring to your attention that the ideas that you see, whether they're in an adult hospital setting as Beaumont is, or in a children's hospital, a lot of the ideas and the approaches will transfer across different settings. And before I move into that, we had a question about what's happening in the labor and delivery room, because some places have basically eliminated any support person. But we have seen many examples, one from Teresa Rogers at IWK in Canada, where they have allow both for cesarean and regular labor, the partner, whoever they choose, to be with them. It could be the doula, or it could be the partner, but it can't be both. They have to choose one, and that support person cannot rotate or change through the process. So that individual stays with the person through labor, delivery, and recovery. If they have to leave for some reason, they aren't able to go back in. So they have created all kinds of messages to help people understand this new requirement for safety, but also recognize the important role that that support person plays in a very important life experience that people have. So let's shift to Children's Mercy really quickly. They have convened a small task force, including a parent who's a paid staff person, and they drafted their visitation policies with infectious disease doctors and nursing people, and ran it by the task force. And then they continue to be very engaged. They have specific plans for and with their PFACs, and they have a number of them in Children's Mercy Hospital. All on-site meetings have been canceled, but they have a SharePoint site for communication. There are Zoom meetings available to keep PFACs connected with how-to support. They realize that in times of fast turnaround when policies have to be changed, they may not be able to initially consult with PFAs in a virtual way. If they can't consult, then what they do is they continue to solicit ongoing input on signage and communication. So they also are using telehealth in primary care and using FaceTime to cover non-emergent things. And they're continuing to encourage virtual ways to stay connected. And they have iPads available for checkout so that people who don't have that resource can still stay connected. What I love about every one of their communications is that they send a clear message, and that is that no visitors, including sibling visitors, are safe to come in, but parents and guardians are not considered visitors. But they do have to be free of respiratory symptoms or a fever in order to be in the hospital. So of course, paying attention to the safety. They had a huge big poster that you've got a copy of. Again, they are reiterating the message about the role of parents and guardians not being visitors, and then breaking things down in color-coded ways so that people can really understand things. The other thing that they're doing that's important to do is to continually set the context for the useful information. So what you notice in this particular slide is very bolded. Please note that this is an emerging and rapidly evolving situation, and who they're getting reliable, trusted information from, the CDC in particular. And then they have some blog posts on their webinar that are pulling in other team members like the child psychologist and the infectious disease person to talk with kids about COVID-19 and debunking the myths. And what I love about their debunking the myths FAQs is they've actually gone out and found that some of the common myths that are floating around Facebook and other social media places, and dealing with those ones that are out in the public and are getting spread and are not correct. So key messages are consistent across, and they always are sharing the why, as Bev is saying, is so important. The last thing that I want to just share with you is a real live example of how parents and people with lived experience can really make a difference in communication. So they needed to cancel elective surgeries, as many of you are doing. And they created, the marketing department communication staff created an initial message that was very fact-based, very short and fact-based. But the PFE program staff in less than 20 minutes reviewed the message, including parent advisors, and repurposed the message to have those facts, which are really important, but also to share that why, and also to, so we must conserve supplies, hospital beds, and healthcare providers to care for those affected. We're still using CDC and national guidelines. We're going to call you to reschedule your child's surgery as soon as it is safe. And then again, that appreciation for thanking them for helping us care for our community. Everybody has an important role. We have more examples, and I'm going to bring Bev back on so that she can share with you some of the examples that she was able to find. Bev?
Great. Thank you, Mary, for all of those wonderful, inspiring messages from the field. I wanted to talk a little bit about the work at Dartmouth-Hitchcock, an academic medical center in the northeastern part of the United States. In early March, they had policies to restrict one family member or friend for each patient. But they made exceptions with the advocacy of nurse leaders for the nursery, pediatrics, obstetrics, and psychiatric units. But like so many of you across North America and beyond are experiencing now, many of these initial policies are changing and are being revised. And the new one is allowing no visitors. And again, I use that word in quotes because I think they're limiting the presence of families who are not considered visitors. But they have made exceptions for the neonatal ICU for a partner or a spouse in the birthing pavilion, and for individuals receiving end-of-life care. What they also said with that change in policy, we understand the important role and that this will be difficult. And they then explained the why. They had signage that would help people when they had just screening, when people still could come, but they were screening everybody at the door. Then they went to a new sign with, quote, again, no visitor policy. But notice they have the exceptions, and they explain the why: to keep patients and staff healthy. That's essential. But at the bottom, they also offer some key support to learn how to connect virtually with a patient. Please visit. And they offered this wonderful material, and this is another one of your handouts. I'm shown here that the heading for the handout: your friends and families may not be able to visit right now, but they can still feel close by. And so showing people how to use a variety of forms of technology to stay connected. So further information, there's a step 2 in this, and it's available in the handouts. They also were using signage throughout and other approaches to help people understand that we're in this together. This is for a period of time, and we appreciate your patience, and to employees, we're grateful for what you're doing every day. Joanna Salenza is, I love looking at this picture. She began working as a family support person many, many years ago. Those babies are now 21 years of age. And she is also the administrator of the hospital-sanctioned web-based ICN report group. And she began working with infectious disease experts and another family advisor to craft a letter that was sent to families that they were so committed to family-centered care, and usually more people could support the parents at this particular time. But they, for safety for all and to limit the number of people that these babies are exposed to, they had to make these restrictions. So she was a key part, she and another advisor, key part of shaping the language. This is another one of your handouts. You can adapt this. You could use this for an older facility. A single mom, a single parent could have a support person with them. But another best practice is, again, relevant beyond the intensive care nursery, is that the medical director talk to the families to explain the change in policy and to reassure them about how they would together care for their baby. In doing this, he serves as a role model for other clinicians, staff, and trainees, which is key as we go forward in this pandemic. Also, as the family support person, she, along with the intensive care nursery's leadership team, made a decision that she should work remotely. They needed to limit the number of people in the hospital and in the ICN. But she's still a full member of the ICN leadership team, and she will continue to participate just like we're doing on this call today. We run all of our office calls by Zoom, and she'll be using other technologies to stay connected with the leadership team for the clinical unit. She's also the key link to the parent council, and she originally scheduled daily office hours so she can stay in touch with them, so they realize how important they still are, that they can stay connected as a council, and that they can be prepared to offer further wisdom and guidance as the needs emerge in the future. She may not need daily office hours as she goes forward, but that's an important thing to think about, how you all are working together as advisors and staff liaisons. And then they have this huge 700-member web-based group for current and former ICN families. They are a conduit for support, but also to disseminate accurate, trusted healthcare information out to the broader community. They've also tapped into some of the clinicians who are not immediately needed in direct care as much as they were before to help with telehealth. And they are connecting families and with the healthcare team and their babies. They are prepared to have HIPAA compliant video sessions if the family becomes quarantined at home, and they're looking into, the social workers looking into how to provide more online support. All wonderfully creative ideas. At Children's Hospital of Philadelphia, excuse me, Amy Kratchman is a family partner in research and a senior family consultant for the hospital. And she's working with a multidisciplinary group to help shape the communications and the dissemination of messages to patients, families, and in communities. Here in this example, the pharmacy people came to her and asked her how they can word messages to keep people safe in the hospital-based pharmacy. So again, such a resource. And again, the connection of advisors to the experts in infectious disease and other clinical expertise at this time, but their perspective is essential. Now, before I talk about continuing care retirement communities, sometimes within these communities, there's subacute care, assisted living, um, skilled nursing. I just had an example and a conversation with people in Canada today uh, with a subacute facility. They don't provide any acute care. They it's Hotel Dieu Grace in Windsor, Ontario, and they have had to move. And again, I put the word visitor in quotes to a no visitor policy. Um, but what they've done, they consulted with an ethicist to make this decision, along with having senior advisors, patient and family advisors, part of the process and guiding the implementation. And they've done two, I think, important things. One, they wrote a letter to all patients and all families, and they have frequently asked questions that these advisors helped write. But the other thing they've done, because they closed all their clinics, they repurposed 20 social workers, and their sole role is going to be they are the family support team, and they are to work with patients and help them facilitate them with, they can be a companion or help continue their connections with family by using technology that the patient might not be able to do alone. So we will have more information on this, but I think that gives you an example of what can happen in a subacute setting. In continuing care retirement communities, we have a huge resource in the residents that are there that can help in reducing the negative effects of social isolation. And for older people, we're all really concerned about that. And at John Knox Village, they have created a whole lot of online resources that and have distributed it to them. I think there are 2,100 people living in this retirement community. There's a resident-led Apple's user group at Falcons Landing in Virginia that now meets by Zoom. They've always valued the in-person gathering, but it works fine with Zoom. And at residents in Charlestown and Catonsville, Maryland, they know that we have to have fun in this and be able to laugh, and that social connection is really important. So they have a small group gathering for happy hour by Zoom. I think the other thing that we need to think about is how we help for those of them, particularly in skilled nursing. Mary talked about writing letters, sending drawings from children. Any way that we can reach out to them, I think, is very important. And I will share a very special family set of pictures with you from when my mom at the age of 104 was in a skilled nursing facility. There was a terrible virus outbreak, not like what we're experiencing today, but nobody from outside the staff could enter the building. And we were all there for Christmas time with the great-grandchildren and the grandchildren. And they spent hours practicing singing in the rain. It was a very rainy day, and they all performed for her. So I think that's another way of reducing the negative effects of social isolation. And now I'd like to turn it back over to Mary.
Thank you, Bev. What great examples, and so practical. And that's, I think, what people are really wanting to hear are the practical examples. I want to spend a little time, and I know we don't have a lot, on strategies for supporting vulnerable populations. One of the things that we have to remember is that there may be other challenges or stresses besides the coronavirus in patients' lives and their families' lives. Maybe immigration status and the policies around that. They may have significant economic hardship with food or housing. There may be cultural and language barriers. There may be substance use disorder or other chronic conditions that are compounded because of some of the other items that I talked about. What we have to do is, we can't do this alone. We have to seek guidance from their trusted helpers to identify their most pressing needs. And and together mitigate for those needs. I just got an email today from SMART from the Start, which is in Boston and Washington, D.C. They're a 2-generational trauma-informed family support system to help with community engagement and school readiness for at-risk families, low-income, underserved communities. And they, of course, their staff now is working remotely. But what they said is that the effects of the pandemic are not going to fall equally across society, and these vulnerable populations are going to feel it much more strongly. And so they have looked at virtual ways to continue essential services, like weekly or more frequent phone check-ins, creating support, taking the support groups and the play groups and creating virtual experiences, and putting their people on telephones to do counseling, to provide both individual and family therapy to the caregivers and the children. But they've also established a crisis intervention fund, and they are doing delivery of emergency food care packages in those communities. And so when we think about how healthcare can work with these trusted helpers, we need sometimes to reach out, and social workers can help with that. They often know these kinds of organizations. Faith communities can do wonderful things. I know that in the Minneapolis, St. Paul area, I was talking to a friend who is very involved with her faith community, and they're working with a couple local hotel motel places that obviously don't have a lot of people filling them up, and they're setting up one as a quarantine for people who are homeless over 60 that have the virus, and then another place for people who don't have the virus but are homeless and have difficulty being able to follow both the social distancing but also just the hand washing kinds of recommendations that we have. And so we have to think broadly about who all is on our team to deal with this. So the other thing that I wanted to share with you, is Contra Costa has done some amazing stuff. They're in California, down around in the San Francisco area, and they offer a health department, but they have a public hospital and clinics and those kinds of things. And of all the websites that I've looked at, and certainly I haven't looked at all of them, what they've done is they've actually used video to share information. So they have written information as well, but as we think about people's health literacy, sometimes even if we have great partner language and we have lots of white space, they may not be able to get the messages that are so important. And so they are doing daily messages and updates about what's going on in their community and what people can expect. The other thing that they've done is they work with a homeless population in a number of their programs. And so they have a frequently answered questions, and we've got that available for you as a download, about coronavirus and the homeless and what they're doing. And they are developing guidance for street outreach workers. They're creating the opportunity for Contra Costa Healthcare for Homeless team to go out and test at shelters or encampments. And so there are a number of great things that they're doing, and you can read more about that in the handout. The other thing that I was pretty impressed about, and I've seen it in a couple other places, but I wanted to just bring it to your attention. And that is that they have been paying a lot of attention to health literacy. And what you can see is they've got coping with stress. They have a whole area around coping for stress, and also a whole area for people who have behavioral health or mental health issues, because obviously if you already have an anxiety disorder and then you're dealing with all the information that's coming. So there are lots of information suggestions, but I love the way that they've used icons and short words to really help people know what are great tips for you to cope, but also great tips for kids to cope. Another place that we have worked with is the Chicago Health Disparity Center. They're primarily they do a number of things, but the person that we've worked with has a research program with a cadre of over 100 trained African-American patient leaders that have serious mental illness. They've had to go to online and phone meetings. But what I loved about talking with Sonia about this is they research resources available to help them stay connected. So where can we get more minutes for less cost? Where can we get access to internet for less cost? They've also, in their monthly calls, polled their members about when their minutes become available so that they can participate and not be isolated at times when their minutes are still available. They've anticipated needs. A number of people are homeless or very low income, so that they can continue to ensure timely payments for participation. And they've also been very careful about the use of their plain language to say, here's what we're thinking and trying to accomplish and to do together. And what will that work for you? What would work better? The other thing that's really important is, as much as possible, vulnerable populations, because of things we know about trauma-informed care, that we need to provide choices and options for participation and be respectful of that. And now I'm going to ask Bev to join me as we kind of wrap this up.
Great. Thank you, Mary. And we both, Mary and I, want to thank so many people. These are just some of the people that we've spent quite a bit of time with over the last couple of weeks. And there are many more of you out there that have been sharing your ideas, the challenges, the creative ways that you're responding to this pandemic. So thank you. And we hope that you will continue to share your ideas. And we also want to express our gratitude to the many Pinwheel sponsors across North America who have been so helpful to our support. And we hope that maybe your organization would like to become a Pinwheel sponsor, and information about that is available on our website. And many of you have asked us in emails and in person and in phone calls about the 9th International Conference, a very special meeting. It's not until late August. We are planning at the moment to hold it in Nashville, Tennessee, but we know that the situation may not permit that. So we are investigating at this moment a variety of ways that we can connect, that we can share information, and that we're prepared for whatever way we can go forward in sharing useful information with all of you.
Great. And the other thing we wanted to let you know is that for those of you that are members of the PFCC Connect community, and anyone can join, it's a free online learning community, we are going to host an informal conversation on COVID-19 next Tuesday. And this really is not a webinar. It's really for us to come together and share what we're doing, what people are learning, what challenges still remain. So we encourage you to do that. But we want to kind of end on a thoughtful note. And I grew up with Fred Rogers, and when this quote just came to me as we were thinking about what inspires us. And he says, look for the helpers. You will always find people who are helping. If you look for the helpers, you'll know that there is hope. And I've listed so many helpers, and not all the helpers that are out there, obviously starting with healthcare workers, from the janitor to the head of the ICU. There are so many people putting their lives on the line, but there are also grocery store clerks that are stocking shelves. But people are reaching out to each other in Italy, which has been just devastated by this virus. They're singing to each other's. Restaurants are opening food pantries, musicians, and we've given you a couple links, are doing things so that you can kind of renew yourself with art and music, and many, many more things. And we have to really recognize that the people in our communities who are following what I like to call as physical distancing, but maintaining and being creative about maintaining social connections, are also unsung heroes. In a year, in 5 years, in 10 years, when we look back on this experience in our lives, I hope that we can say, after all this is over, all that will really have mattered is how we treated each other. So be kind to yourselves as you're stressed. Be kind to the people that you work with. Be kind to those that you've built partnerships with, because it really makes a difference. As we deal with this ever-changing situation, by being in it together and treating each other kindly, we're going to get through it. And despite the fact that we haven't given you as many times for questions than answers, perhaps, Marie, you can help us with a question that you've seen over and over that we might be able to quickly respond to.
Um, Great, Marion, Bev, thank you so much. And thank you for everyone who has chatted in questions. If we don't have time to get to all the questions, but we will respond post-webinar to all the questions that haven't been answered so far. It's 5 o'clock. One question has been about those who do not have technology and how to connect them if they're not using technology. So how do you connect the patients and families? And if you have a quick response to that, that would be great. If not, we can follow up post-webinar.
Marie,
Well,
go ahead, Mary.
No, the one thing I want to recommend people do is don't forget that writing notes and dropping them off, not relying on the post service, but dropping them off that healthcare members can take in and read, maybe the social workers, can make a big difference. Sending photographs of things that people care about and printing those out on our printers. It may not be the best quality, but here's a picture of the flowers that are blooming in your garden now. We hope you'll be back in your garden soon. We can be creative in those ways. Bev?
I think we have the old-fashioned phone that can be used, and sometimes one side of the group has technology and the other doesn't, so that with the example I gave from Hotel Dieu and Grace in Windsor, that the social workers are providing the technology for the patient, and maybe someone in the community has the technology on the other hand. But I think I agree with Mary. We're going to get smarter and more creative as we learn how to do this, and welcome everybody's ideas about that. Thank you, Marie, for the question.
And we will be creating a FAQ that we can post on the responses to these questions. So thank you all for taking time out of your very busy days to make time to be thoughtful about how we sustain our patient and family-centered care core concepts in the different communities that you serve. We hope that you have a great day and that you stay safe out there. Take care.